All right, welcome to the KLAS In Session podcast. I'm Justin Long, Managing Director of Investor Services here at KLAS Research, and joining me today is Aaron Feinberg, a partner at Bain and Company. Aaron, great to see you and have you join me for a few minutes.
Great to see you. I'm thrilled to be doing this and excited to continue the partnership that we have with KLAS in the provider and payer IT space.
So I can't believe it's been 4 years that we've been co-sponsoring this research and this annual report. This 2025 report we just published a couple of weeks ago, and I think the goal today is just share some of the highlights of the report and some feedback that maybe we're hearing around the report. I guess let's start with specifically, just maybe for the audience that's listening, this report up over the last 4 years has focused really on investment spend and priorities amongst healthcare executives, and more recently over the last 2 years, payer executives. And we've interviewed, I don't remember the exact amount, I want to say it's 228, but over 200 executives this year. And while we continue this longitudinal data set of identifying what categories or spaces that are number 1 through 10, we won't focus on all 10 of those, but there's been some changes, there's been some movements, and I think it'll be interesting to the audience to say what has moved to number 1, 2, and 3, and why. So that's one, and then we've added some additions to this year's and report as well, Aaron, that hasn't been in the first 3 years, and maybe just from a really high level, we'll touch on these and maybe even delve a little bit deeper. But what were the new additions to the 2025 report? And one's right inferred in the title itself. So I'm leaving it a bit of a mystery, I guess, for you to unveil here.
Yeah, so this year's report is subtitled AI from Pilot to Production. And I think what's really interesting is just to see the extent to which providers and payers alike are increasing their investments in this space. Last year's report was the first one where we really began to get a preview of some of these insights, but we were still pretty early days, and frankly, all of the activity was still in pilot. We got some early looks just in terms of where people were piloting and where the energy was. But this year, we've added a whole nother section, really unpacking where people are in production, where people are seeing ROI, and where people are looking to frankly double down on those investments based on some of the early wins. So excited to talk more about that when we get there.
Absolutely. And again, there's our teaser. We'll dive into that here in a few minutes. Maybe let's just take a step back, Aaron, and just say big picture, the state of healthcare IT. And this was, obviously in our report, considering economic uncertainty and margin pressures that our healthcare systems are facing and other challenges as well, IT still remains a top priority for providers and payers. And I guess the question is, and as we both spend so much time in this, what's keeping healthcare IT spend so resilient right now?
Yeah, you're absolutely right, Justin. I think healthcare IT spend across all 4 years that we've done this study has been a top priority, and frankly, a category that health systems and payers alike are spending more money in, right? So from a backward-looking perspective, when we ask people about how their spend has changed over the last 12 months, they're consistently telling us that they've spent either more or far more on IT. And then on a go-forward basis, when they're looking at the next 12 months, they're continuing to cite increased investment. So we think that's a pretty robust fact pattern, that it's not just a forward-looking prophecy, but people are actually spending more on technology. And it is interesting to see in light of all of the pressures that operators are facing. But the reality is that it's a top strategic priority, because this is really the one lever that they're banking on to get them through some of these challenges, right? So we saw this in some of the first editions of our report coming out of COVID, all the staffing challenges, for example, that providers had, and that they were leaning on technology to drive greater efficiency and greater utilization of their providers. I think we continue to see that on the provider side, and right now we're seeing similar dynamics on the payer side, where frankly, payers are seeing this as even greater priority because of all of the squeeze that they're undergoing right now with respect to, for example, in the MA line of business, B28, and then just kind of looking forward some of the Medicaid redeterminations, et cetera.
Absolutely. And I think we cite in the report, as you alluded to, that 85% of providers rank IT as their top strategic priority. So yes, I think it strongly indicates spend is increasing year over year. Do you feel like there's more cautious optimism as well? Is that maybe driving some of this, despite, like I said, some of the undercurrents or headwinds that healthcare and I guess other sectors are facing right now as well?
Yeah, I think that it's just become a strategic imperative to at the board level where boards and CEOs are leaning in and seeing technology as a potential lever to differentiate their organization, whether it's a provider org in a competitive geo that needs to provide a best-in-class patient experience to attract patients and kind of win share and make sure that they limit leakage, to a payer organization that wants to deliver on best-in-class member experience to make sure that they have the right stars ratings and they get the right survey feedback. So I think across the board, people are seeing technology as a business differentiator and trying to experiment with new ways, particularly AI, kind of even further broadening the aperture and in some ways freeing budgets to be a little bit more creative. Obviously, always ROI linked, but trying to push the envelope.
Absolutely. And then we'll discuss a little bit more around value creation and where the emphasis is, but you certainly touched on that. Aaron, maybe let's pivot slightly as again, as I talked about the focal point of this report for the last 4 years, and I think it's still a core element naturally, is what categories or segments receive the most emphasis or focus, and really where did providers tell, we'll start with providers, but where did providers tell us, the respondents that we spoke with, that they're putting the most investment and spend in? And we have a new incumbent this year. They were 2 years ago, right?
Yeah. So,
and why don't you share a little bit of who it is and or what category it is, and why is the spotlight back on this category?
so I don't think it's surprising to any of our authors and probably to any of our listeners, but Rev Cycle is back with a vengeance. Last year, they were knocked off the perch by, frankly, IT infrastructure related to cybersecurity. So last year, there was a big bump in spending there in light of the Change cybersecurity incident. But outside of that blip, Rev Cycle has been the top priority for 3 out of the 4 years that we've collaborated in this research. And I think it's for good reason. I think pretty universally, providers are citing Rev Cycle as the top priority because it's driving hard ROI for them, both on the revenue as well as the cost side. And in this environment, that is going to be easy for organizations to really rally behind.
Absolutely, yeah. I think it's not surprising, as you mentioned, and I kind of set it up in a way like, oh, we have this brand new front runner, but in reality, there's a lot of activity around the hoop, and you said it well. We won't go through all 10 categories naturally for sake of time, but there was a lot of focus and emphasis on work, and naturally number 2 and 3 respectively is clinical workflow optimization and then EHR modernization. I guess the question is, and maybe I'll ask you this first of all. Clinical workflow optimization can sometimes be viewed as very broad, right? What is incorporated into that? So maybe just for our listeners, how did we look at clinical workflow optimization? Just briefly, what factored into that space or category?
So I think clinical workflow optimization is an interesting category. It's one that's incorporating different tools to make providers more efficient. Some of them are departmental solutions, different forms of communication and collaboration tools like the clinical communication collaboration category. But I think this category is important to folks for one of the very reasons that we cited at the beginning, right? It's all about making labor more efficient. Labor is by far the largest cost that providers are bearing, and it's their source of differentiation. So people are willing to kind of go that extra mile to make sure that their providers are well utilized and driving excellent outcomes for patients. And then I think in the EHR category, that's interesting because I think there's just frankly a lot of divergence in that category in terms of what people are spending on and looking to do based on where they are in the EHR adoption journey, right? So It really runs the gamut. I think that there continues to be a wave of migration, frankly, to Epic, and a decent amount of the spend is people doing wholesale migrations. But then even people that are on a pretty stable instance, we see a pretty big push to drive investments in cloud infrastructure and improve the stability of those systems, improve, frankly, the speed of access. Because, Justin, I know you guys put out a piece of research earlier this year that was surveying providers around their EHR experience, and frankly, and a crazy percentage of them experience lag and slowness in their operating environment, which is not only a big dissatisfaction source, but also just flies in the face of this workflow optimization point. So curious if you had any reflections on that.
Yeah, I was actually going to touch on that in a moment or two, but let's dive in. You set the ball on the tee. Let's see if we can hit it down the fairway here. But no, as you refer to that research, yeah, I mean, we've found 70% of clinicians or less feel like their EHR is fast. And but you know, as you mentioned, we're seeing 6 in 10 organizations, and this was our co-sponsored research. And we found the same thing, that organizations are first and foremost looking at their EHR first, yes, over best of breed or third party solutions. So there's a bit of a chasm there, and I think at the end of the day, as we look at that, I think the real question I think for everyone is: are organizations prioritizing integration and simplicity over best of breed functionality? Because there's certainly trade-offs. I mean, what's your thought on that? What do you think?
Yeah, so I think it's a great question, and this is a new piece of our research together that you teed up at the beginning. So one of the questions that we perpetually get from our clients looking to make investments in the category is, frankly, how they can do so away from Epic or other EHR risk, right? What solutions, will providers buy on a best of breed basis versus not? So I don't think there's a universal answer to the question. I think what we did in our research is try to understand holistically where organizations fall. And sure enough, there are some splits where, for example, somewhere around 7% of organizations on the provider side said that they strongly default to best of breed solutions. Pretty small portion, frankly, are doing best of breed, whereas 28% said that they strongly default to EHR-native solutions. So there's an overall bias to EHR-native. But frankly, it's going to vary by category. So this is the interesting piece of our research. We asked the respondents category by category kind of what their preference is, whether they have a stronger likelihood to use EHR versus best of breed. And we segmented these into those categories where there is strong best of breed bias versus strong EHR bias. For example, on the best of breed side, we see people wanting to buy ERP and human capital management, GRC, and then IT infrastructure on a best of breed basis. On the EHR side, we see people heavily leaning on EHR for patient access, so something like Epic MyChart, clinical tools and departmental solutions, and then clinical workflow optimization. I think what's most interesting, frankly, about it is to hone in on what we're calling the battleground categories. So where there is even competition between EHR and best of breed.
Absolutely, you said that well, and no matter how you slice and dice it, and I think our listeners, vendors, providers, all categories will agree. As much as market share would love to be dominated by the EHR, there's areas that they continue to do very well in, and they expand in, as you referred to some of these categories. And there's still a lot of gaps and misses where they just certainly aren't performing. And so best of breed and third-party solutions, I don't think ultimately are going away. And I think we both agree to that. But yeah, I think picking the lanes is, and especially as an innovator and as a vendor, being in the right lane, obviously, to continue to drive innovation and meet these needs, margin pressures, efficiencies, and optimization that these providers and payers are looking for. So
just one more point here, Justin, I think is important to underscore, which is that this is a dynamic market. In other words, today people are biased to, for example, buying ERP and human capital on a best of breed basis away from their EHR. But it's really interesting to see the investments that EHR makers are having and making in this category. For example, Epic just launched its ERP the last couple of years, as well as some HCM solutions. So I think we need to be looking at these survey results year on year to just see how that bias is going to change. And I think all of us are really going to be looking forward to looking at next year's edition and see, how much traction EHR vendors have really made in some of these categories that are biased against them.
That's a great point. It does continue to evolve. And since we're saying one last point, I'm going to throw one last point out here as well. And we can just keep building off last points if we want here. But, I think there's obviously still trepidation. And we hear this time and time in our own research for providers and or payers to go all in, right, with one company. So, for example, if you look at RCM, end-to-end, there's a lot of end-to-end functionalities and products that are tremendously well integrated, but a healthcare, and I think this goes back to the change, cybersecurity incident a couple of years ago, for a provider to say, I'm all in with one particular vendor, for whatever reason. If something breaks, there's a cybersecurity incident, then I'm stuck, right? So I think that still also exists, but to the points that we've discussed, it's going to continue to evolve. It's going to change. EHR, there's no doubt, continues to expand its share and presence in other areas, and it's going to be interesting to see as it evolves in 2026.